And in a little, we have the gorgeous Dr. B joining us in the studio. She's giving us the 411 on all things Botox. So even if you're just a tad curious about it, you'll want to stick around and check it out.
Oh, yeah.
All right, so we have a very special guest with us today. She's a world-renowned dermatologist out of Beverly Hills. Please welcome Dr. Hale Bakshande.
Yay! Hi! Hello!
Hi.
Welcome,
Hello, Dr.
Thank
B.
you. I'm sorry, first of all,
Look at this outfit.
you are a vision.
Let's
have a seat.
Thank you for
and have a
having
little
me.
chat.
Yes, thanks for being here.
Gorgeous, I can't.
Okay, so we've been asking for a Botox 101 class for a while. Let's start with the basics.
Yes.
What is Botox?
So Botox is a purified protein. It's actually considered a neurotoxin. So it's derived from a bacteria, and the way it works is it blocks that transmission from the nerve signaling to the muscle. So it'll cause that muscle group to relax for about a 3-month period.
Interesting.
I love it. Now, I happen to be a huge fan of Botox, but not for my face. I have hyperhidrosis, which, as you know, is overactive sweat glands, for those of you who don't know, and Botox has been a literal lifesaver for me since I'm 16.
Yeah.
Really?
Yes, because I would show up to high school, it wasn't well air conditioned, and before first period, I had full-blown pit stains, which is embarrassing for a 16-year-old. It was wildly uncomfortable. It's not just a lot of sweat, it smelled bad as well, and the Botox has helped control the sweat and remove the smell.
Right.
So I can't go without it. I can notice
You're a big fan.
when it's time for my next cycle. I can tell when I'm due.
Usually lasts you about 3 months.
It actually lasts me about 6 months.
Oh,
I
that's
usually go
great.
twice a year. I got really
Wonderful.
lucky.
Wonderful.
Yes.
Yeah, and that's the same way. It blocks that transmission from the nerve to the sweat glands.
It's incredible.
Can't it also help too with your jaw? Maybe if you like clench your jaw or something like that?
Migraines.
Yes,
Oh,
Botox
migraines
has
too.
a few indications. So muscle relaxation is one of them, but it also works for muscle spasm, and it's actually an interesting story. That's the way Botox was discovered.
Really?
Botox was originally back in the 80s, even before then, it was used for lazy eye and blepharospasm.
My grandma had Parkinson's, and they would give it to her in her eye because it was spasming and
So
twitching.
they discovered that these patients were kind of losing their lines on their forehead and their frowny lines, and they were onto
Amazing.
something really
Oh, wait,
special,
that's
and that's
incredible.
how
I
they got their
think I want some
indication.
of that.
We do actually, we have a video. I had my appointment recently for my hyperhidrosis. So I took a little home video for you guys. Oh, yep, there it is. So I get 25 injections under each arm, which is a lot of injections, but most of them genuinely do not hurt at all.
Is it numb at all?
Nope, no
Okay.
numbing at all for the underarm. There's a couple of areas where I feel a little bit of a pinch, but genuinely most of it is pretty pain-free.
Interesting. Because you'd think it was kind of sensitive, but I guess
There's
not.
just a few areas where you can feel that little pinch, but most of it is totally fine.
Yeah, you can use ice, you can use numbing cream. Every doctor is a little bit different in what they do to kind of make the comfort level, but the needle's really small.
It's
so
very small.
It's surprisingly not uncomfortable.
Yeah, no, I mean for
And
25
it's
under, oh my God.
Worth the results.
Even if it was painful for me, it's so much more worth it to have the effects afterwards.
And you honestly, Natalie, you are dedicated to
thank
the
you.
FabFitFun life here.
I have donated
I don't
my
know if I
body to you
would've-
guys.
Yes, you've done it all. We really appreciate that. Leave Natalie some love, you guys.
Thanks, girl. I love it. It's so great.
Yeah, and so talking about like getting Botox, how do you know when you're ready?
So I get that question asked a lot. What age? When should I start? And basically this is the way I like to explain it. You are going to have lines when you're making expression. Almost everyone does. So when you pull your brows together or you raise your eyes up, you are going to have those lines. It's if the lines are there when you are at rest.
Okay.
Are you starting to see some creases kind of lingering there even when you're not making that expression?
Got it.
Gotcha.
If the answer is yes, then it's time.
Okay. Do I have a lingering line?
A little.
I'm gonna let her answer.
Okay, well, we'll talk after. I will go for an appointment.
I love it. And
Sounds good.
what's the average cost of a round of Botox?
So you're going to find a lot of variation, especially depending on where you are, what city, but typically you can kind of bank on around $200 to $250 per area. And when we talk about an area, we're talking about the frowny lines being one area, around the eyes or crow's feet as one area, and the forehead as one area.
Okay, interesting. And then what about, okay, so I've definitely, like, after living in LA, it's definitely an open conversation here. Botox is something that is very, like, freely talked about, and people can get it at any sort of age. And I know you were saying, like, if you have the line after, but is there such thing as preventative Botox? So if you can't see the line? Okay.
Absolutely. So you want to think about it when you are contracting that muscle day in and day out for however many years. That line is going to start to get very
worse,
creased.
right.
So by preventing that muscular contraction in whatever area we're talking about, you're going to prevent that deep line or deep crease from happening.
Okay. So
Yeah, so it does definitely help in prevention.
And what would you say on, like, a woman, or maybe this might be different from person to person, where is, like, the most common area? Is it
the
this?
frowny?
Is it the sides of your eyes?
Probably the frowny is the most popular
Because
area.
people get this too, right? The
Correct.
lines
So that's an area that we'll be seeing a little later on today too.
Oh, okay.
Yeah, we have a couple of Botox newbies standing by, one of who happens to be our show producer, Lauren, and she has been contemplating getting Botox for a while now. I've seen her at her desk doing her little frowny
Like,
test.
seeing, is the line still there?
So I know she's been very excited about this, and let's bring her out. Lauren is here. Hi, Lauren.
Hi guys, hi Dr. B.
Hi.
Lovely to see you.
Likewise.
So as I mentioned, Lauren has never had Botox before, and we sent her to Dr. B about 10 days ago for her first ever round of Botox to work on her frowny situation.
Her 11.
Yes, her 11.
Yeah, her
I
11.
only had a 1. Right, Dr. B?
Okay.
That's
She only
right. You
had
had
a
a
one.
stronger
Sorry.
side for sure.
But let's take a look at Lauren's before photos and her frowny video. So we've got her before photos here.
Yeah, so you can see she's really contracting her two eyebrows, and then you can see that one crease is really deep.
And her frowny video. Let's see it. Oh,
Oh, yep.
See when I let go? Ooh, it's still there. See how deep it is?
Yes, I see. Okay,
Yep.
so that
But,
is
like,
what you look at.
A 1, not an 11.
A
Just want to
1.
point that out one more time, everyone.
She's got a 1. Oh, can we see a close-up on Lauren's brow area where Dr. B injected the Botox?
So we're about 10 days later, which usually is around the time where you're going to see the effects. So anywhere from a week to 10 days.
Okay.
Give us a good strong frown. Let's see how.
I think we're going to split the screen so we can see, we can get a full side by side here. I want to see everything.
Are
Yes.
you ready? Tell me when.
Ready,
Am I in the
go.
right spot?
Yeah.
Wow.
She can't even do it.
Ha! Magic.
It's like I feel like you're not even trying with all your might.
I really am. This is like, this is me trying as hard as I can to like,
But you can't.
it makes my eyes close.
Yeah.
But
it
like,
looks great.
Right? This
Honestly,
is 10
it's
days
so
later.
smooth.
I was
Yeah.
so nervous going in because I'd never done it before. I didn't know if it was going to hurt or what it was going to be like. You were so lovely. It did not feel like anything. And then I came back to work and like every day I was like frowning. And then I was like, I wonder if I'm like messing it up because I just kept like trying to frown for people.
Right.
But here we are 10 days later and I think I'm very, very happy with it.
I'm so glad. And you look so natural. You don't look,
Yeah,
you still have
absolutely. Not at
expression. You can still raise your eyebrows up and smile and all that. You're just not making that scowl anymore.
Yeah, it's great.
Yeah.
Big fan,
I love it.
Dr. B.
What do you think? Are you going to keep this up? You're going to continue your Botox journey?
So I think I am going to continue my Botox journey because that, I mean, it's just such a big difference with that like deep furrowed frown line and I don't really feel like I want to do much other than that. I just feel like that change on my face is so significant that
Right. And
I will be
everyone's going to
keeping it
have an area that bothers them more. So for you, it was that area, and we solved the issue.
You did, thank you.
What would your advice be to newbies?
I would say if you're at all interested, just a little curious, go see someone like Dr. B. And it was such an amazing process. It didn't hurt. And now here we are 10 days later and my frown line is gone. So I'd say go for it.
Amazing.
Yes.
All right, so I think it's time to see Dr. B in action live. So Lauren,
do it.
we're going to say goodbye to you. Thank
All right,
you so
ladies.
much.
Bye.
Bye. All right, let's head over to our beauty studio.
I'm so excited for
Let's
this.
take a walk. All right, I am ready to see this happen.
Me too.
All right.
Okay, so we need our second newbie out here. Liz, would you mind please joining us?
Hi, Liz.
Hello,
Hi
Liz.
there.
Welcome.
Thanks for being here.
Thank you.
So Liz, what areas have you and Dr. B decided on today to work on?
We've decided on my frown lines, right?
Yes, well, we were talking about, so give us a good frown, give the camera a good frown, so we can see we've got this strong pull here that at rest, go ahead and relax. You can still see a little bit of lines there, and then raise your eyebrows up real high. So that's the frontalis muscle. So we're gonna kind of relax that too. So we're gonna do 2 areas for you.
Okay.
And then we'll be able to kind of get a good look at how she looks about a week from now.
Yes,
and
we're
show
going to
all of
check
your
in with
viewers.
Liz
Okay.
about
Yeah.
10 days
Great.
from now.
Yeah, and you've never done Botox
No,
before.
never.
Nothing to be afraid of. It's a
Okay.
really small needle, and I'll walk you through it. Real
Perfect.
easy.
Great.
All right,
Okay.
let's do it.
Yeah.
Go for
I'm
it.
so excited. I get
too.
so fascinated by these things. So if I get
Oh,
all
I'm
up in
really
your grill,
jealous,
I'm
Liz.
so sorry.
Feel free to. You're good.
All right.
So is there a reason why you haven't done Botox before? Just maybe you weren't ready, hadn't thought about it?
Ready yet?
Okay.
Yeah. So now I am.
Oh, yes.
You're like,
Being
I am
38,
ready.
it's time.
Oh my God.
beautiful
I was
skin,
just going to
though.
say, I would never have guessed your age. Wow.
Wow. Shoot, I'm gonna start some preventative Botox.
Right?
ASAP. Just dip my
Man.
toe in. See how it goes.
Just
All right,
right.
so we're gonna clean the area just a little bit with the
Okay.
makeup, and then I'm gonna have you ice a little bit. And icing really helps with, it helps a lot with kind of getting the area nice and cold, and prevents also bruising. And there's always a chance of bruising. We're using a
Sure.
needle, so
Okay.
we're just gonna wipe a little bit.
But a little bit of bruising, nothing that concealer or foundation
Absolutely,
can't cover up.
absolutely.
And is there a regimen that you need to follow afterwards to take care of it? Like maybe like the first day?
You know, you're not supposed to lie down for a few hours after you have the treatment, but other than that, anything goes. You can still work out and you can put makeup on and concealer on, so there really aren't any restrictions. But you're not going to really see the full effect of the Botox until about a week has
Okay.
passed.
Right.
Okay, great.
Yeah.
All right, so we've got some ice here, and can we get a good look at the needle too, and just how
Sure,
thin that
it's
is?
really
It's so tiny, you can't even
It's
see
a
it from over
33
here.
gauge. They don't even make a tinier needle than this. So as it's entering, you're barely going to feel a thing.
Okay,
Okay.
These are the cutest little ice packs.
Yeah, they really do. They look like a Tide Pod
They
or
fit
something.
exactly
do.
where we need them.
Nice and cold. This got to be refreshing on a
Yeah,
hot
feels
summer
good.
day. Yeah.
All right, so I am going to have you frown just a little bit, really nice tight frown. Okay, and then you're gonna relax. We're gonna have one little pinch there,
How you doing, Liz?
Good. Totally fine.
one little pinch there, and a teeny little pinch in the middle. How did that feel?
Fine. Didn't feel a thing.
And does this go into the muscle?
It goes right into the belly of the muscle.
Okay.
This is the glabellar muscle that we're working on right now. And then we're gonna go across the forehead. So raise your eyebrows up again. There you go. Okay, relax. So let's ice you just a little bit again.
And that was fairly painless for you?
Very painless.
Very painless.
Very
Love that.
Mm-hmm.
Yeah, I mean, it is such a small
It's so
needle.
tiny, and it also is very
doing great.
quick.
It
And that
is.
was 1,
It's
2, 3,
very
and done.
quick. It's very quick. Okay, so raise up again real high. Perfect. Relax. And I do that because I kind of want to see where she's pulling from. So teeny little pinches right across the forehead.
So how many units do you use, and do you decide based on when you see the patient?
Yeah, it depends. Everyone's different. Raise up really high again. Okay, relax. Everyone's different. And depending on what and how strong her contraction is, we kind of decide that before, and we'll kind of map it out. And you are all done.
That was it?
Yeah.
Oh my God.
That's crazy.
Little bumps she's got. They almost look like tiny little mosquito bites. Those are going to dissipate in about 10 minutes.
Oh, amazing.
So no one's going to know that you had this done. And then in about a week, when you make your expression, it's going to be nice and
Perfect.
tight and smooth.
Great. Thank
All
you.
right.
Yeah, we're going to check back in with Liz in 10 days just, to see her results, and we're going to post them in our community so our members can get a good look. How are you doing?
Perfect.
Great. I feel fine. Yeah.
It's amazing.
Thank you
Easy
so much.
peasy.
You're welcome. You were a champ.
Thank you so much, Liz, and to Lauren for allowing us to join you on your Botox journey.
you.
Thank you
Thank
so
you.
much.
You've inspired me. Made it look painless. I want to try it.
Bye, Liz.
Thank you.
Amazing. That was incredible and so fast.
Right. So fast for really big, long-lasting results.
Huge
Absolutely.
results.
Yeah.
Absolutely. Thank you,
Amazing.
Dr. B. You're seriously such a blessing to have on
My
our
pleasure.
show. It's been
My
absolutely
pleasure.
great. You know so much about skincare, and I feel like I learned a lot. I feel way more
Knowledgeable.
about
Yeah.
the whole experience.
And just informed.
Good,
I
I'm
think it
glad.
helps being informed when you go into something like
That
this.
always will help people's fears, is to
Especially-
know what they're going for.
When you look on
Absolutely.
the internet and you find stuff you don't know if it's true or if it's not, and having an expert like you, I feel like really calms people's nerves about everything.
Oh, and I also think it helps going to someone who you think you can trust. They're a
sure.
good way to vet out who you're going
Absolutely,
to. Something
absolutely.
you would recommend
I
looking
mean,
up?
I think you need to go to someone who's qualified. A board-certified dermatologist is always a good bet. There are other physicians in the realm, like plastic surgeons, who also do this. So I think that you should know who's injecting you and their credentials. It's always very important. I mean, it is your face.
Of course.
And you shouldn't just trust anybody.
Yes, absolutely. Thank you so much to everyone watching our Shop Live today. Have a wonderful 4th of July. Bye everyone.
Bye.